Khayelitcha is home to nearly 2 million of South Africa's poorest residents. Almost 70% are unemployed. The rest travel miles to work as domestics and day laborers in nearby Cape Town. The lack of health care and proper sanitation have led to epidemic levels of disease in both the young and the elderly. Yet, despite these grim circumstances, residents of Indlovu Park have maintained a spirit of hope and are turning their situation around. The Indlovu Center is the result of that community effort. The project is spearheaded by Buiswa Tonono and Di Wormersley.
Working in a situation of extreme poverty, one has to be extremely careful not to come in with the approach that I know what's good for you, this is what you must do. And that is what we avoid at all costs. We work very much in response to an expressed need from the community because the people living here know what they want. So it's up to them to say, this is what we need. And then we respond to, okay, this is how we can get it done.
The first thing the community asked for was a daycare facility called a creche, a safe place for working mothers to leave their children during the day. Built entirely by the residents in the area, the creche was transformed from a simple tin shack into a fully equipped daycare center. The center cares and feeds 35 children every weekday.
And once the creche started really coming together, there was proper facilities for the kids. Buiswa approached me and said, look, there's a lot of very hungry people here. Can we help maybe putting a soup kitchen in? So we thought, okay, next need is a soup kitchen.
Using vegetables from the center's organic garden, the soup kitchen now serves upwards of 200 people a day.
Then the soup kitchen got up and going, and then Buiswa said to me, well, Mama Khayelitcha, people are being fed, but we need a clinic, we need a doctor.
The clinic building was constructed from a donated movie set. In an effort to do more with less, a 2-story building was constructed. The clinic would be downstairs, upstairs, the teen center.
That's a place where we keep the kids after school and during the week. We're trying to prevent them not to go to the shop-ins where the first place is to have the pool tables, all the fancy games. Now we try to have it there in the center, so to stay out of trouble.
These programs have been created and run by the community at a minimal cost. The clinic, however, is an expensive undertaking. From 8 in the morning until 4 in the afternoon, the clinic provides services for residents from all over the Khayelitcha community. The clinic usually treats the elderly for asthma, arthritis, and other illnesses brought on by the stress of living in poverty. And the young typically suffer from malnutrition and intestinal parasites. But the age group most at risk are sexually active teenagers.
We have an HIV infection rate in this area of 45%. It actually gives me goosebumps. It's frightening. It's terrifying.
The center will soon have a social worker to counsel teens on pregnancy and HIV prevention.
Everything that we've done here has been in response to the express need of the community, except for this building. Where these two little cottages are now was one shack where Boyiswa's daughter lived. And I said to Boyiswa, if you give me that piece of land, I want to show you something different. And 4 old people, 2 youngsters built this building, and it's made from sandbags and eco beams. My purpose behind this was multifold, to show people that they can build their own houses and that they can make something really beautiful. So we constructed this as a guest house, and we have had people from New Zealand, Australia, America and Scotland staying here, and England staying here. And the money that we get from people staying here in the guest house, we use to buy the medications in the clinic. So we've got a little circle starting to happen.
What the center needs now are your donations to keep up with the increasing demand for their services. To become self-sufficient, the Indlovu Center needs your support in another way.
We need skilled people to come and work here, to stay here, to share what they have and to experience this amazing community. And that's going to generate a lot of money for the project.
With your help, the center will continue to grow, bringing hope to a new generation of residents of Khayelitcha.
But I have a vision. The whole of Monwabisi Park, which is approximately 15,000 shacks, I want this to be the first true eco-village in South Africa, where people build their own houses, they grow their own food, everything is run on natural energy systems, and developing this as a model, as a blueprint of how to upgrade a squatter camp into something that is beautiful, that is organic, and that gives people dignity. It's going to be a beacon for people who think they have nothing, but in actual fact, they have a lot. This is going to wake them up to see, wow, you know, we built a house with our own hands, we can grow our own food, we are not useless. Just because we are poor, we're not useless. And that will make a huge difference. That will put a positive boost into this place, into Khayelitcha, into the people of Monwabisi Park that is desperately needed.
Oh, Ethiopia.